read, pardon me?
Stand by. We're getting ready to go up online. Go ahead.
And-
I'll let you know when we're live, and then I'll duck out. Okay, we are live on the air.
Okay, I'd like to read this statement. Due to the COVID-19 pandemic, local state of emergency, and Governor Beshear's executive orders regarding social distancing, this meeting of the Urban County Council is being held via video teleconference pursuant to Senate Bill 150, as signed by the governor on March 30th, 2020, and Attorney General Opinion 20-05, and in accordance with KRS 61.826, because it is not feasible to offer a primary physical location for the meeting. And so welcome, everybody. I thought it might be helpful if we have a regular update. It might be helpful to you, update on our COVID activity within government. And then if you have questions, we'll do questions, and we are live to the public. And so I know that Sally, are you prepared to give the short update beginning, it says beginning May 11th?
Yes, ma'am.
Okay. Can you briefly run through that? And then I'm going to update by department what's going on.
Okay. We are looking and trying to follow, or going to follow, the guidelines that the governor has for reopening on May 11th for his businesses. And of course, we've already been open, but to let you know what we're doing on there, we're continuing all the telework that we have already had. So we are not bringing people back that can work at home. So we've got a lot of people out doing telecommuting. We have to make sure that the employees who need accommodations as far as childcare, or if they have tested positive or anything, are accommodated, and we have all that in place. So we already have the CARES Act in place. We're doing our social distancing, and we have got the instructions say that people, that when you are in public, you're supposed to wear the mask. And if you're in the privacy of your own office, you can take that mask off. We have gotten now, the mask have been the problem, but we've really sort of done well the last few days. So we have got thousands now of disposable masks, and they're being put out to the agencies. The cloth masks, we have ordered 6,000 cloth masks, and they will be here the 8th of May and the 12th of May. And then we are having a large supply of disposable masks that we'll put at all our buildings for people that come in and did not have a mask. So we're going to have this mask. We have plenty of masks. And our plan is, with the cloth mask, is to give every employee who doesn't have their own, 2 of them, so that they can keep them clean, through the week. Then the other stipulation is gloves. And those people that are dealing with mail, they're dealing with cash. That's not many people, except we've got revenue dealing with lots of mail. And then when you're touching computers and things that other people are using, you're supposed to have gloves. And so we have got, again, 8,000 gloves that are arriving on the 8th of May. So we'll be covered there. The sanitizers we're just trying to get now. We've got a lot of the sanitizer, but we've got to get those bottles that you spray. They're hard to get. So we've got those on order. The thermometers, in his instructions of going back to work, we do not have to take that temperature at the door. That was what our fear was, because right now those instructions read that employees are to be instructed to take their temperature at home. And that helps, because these thermometers are really, really hard to get. We have got, I think, 200 of the handheld on order, and and some more of the infrareds, but we're just going to place those in various positions. So I think, and we're supposed to appoint a healthy at work officer, and we have done that, and John Maxwell has won that prize. There was a hefty competition for that, and John has been selected.
The nurse lost out.
Yeah. And we've restricted the common areas. All the break rooms are restricted, and they've just got one at a time signs on so that we don't have congregation in there. Our lobbies we have to watch, but we don't have much crowd in those lobbies, at least in this building anyway. So we'll watch all that. Now, so what we're doing is we just want to make sure there's not more instructions coming out today. And if not, we will put this all into an email that's going to be sent out to all our employees probably tomorrow. And so I feel pretty good about what we've got our supplies in. So I think we're good.
Sally's been working really hard on this. Sally, I want you to clarify now, this is to bring people back to work. This is not to open up to the public yet.
Yes, this is not to open up to the public yet. This is to bring people, we've had all our people came back, last week. But this now is, the governor has talked about May 11th and those masks being mandatory. So we've got to get on the mask now. And this is like everything else. We have some people that want to do this and some people that don't. So it's going to be, we're going to enforce it. This morning we were talking about, somebody said, what are you going to do? I said, I'm going to assume that somebody is looking at me all the time and could take my picture. So I'm going to walk in here with that mask on. Anytime I'm outside of this office suite, that mask is going to be on, because I think it's just mandatory that we show that, especially the senior staff, shows that we're taking this, very seriously.
Yes. Thank you very much. And now this is different from, if you watch the governor's 5 p.m. Update yesterday, you heard him say he will have plans for government by next week. So, there's a lot of moving parts to this, but what Sally's been working really hard on is how to get as many people back as we need to get back and follow the guidelines. So that's kind of a first step. And we'll still have a lot of people telecommuting. So do you have any questions for Sally before I go forward with some department updates? Just, chime in. Susan and then Jennifer. Excuse me, Councilmember Lamb and then Councilmember Reynolds. You're muted, Susan.
Excuse me. Thank you, Mayor, and thank you, CEO Hamilton. This has been a day-to-day, ongoing change, by the moment type situation, and I think what I'm curious about is with the returning with the 50% of the workforce. I mean, are we going to pretty much do like what the governor was talking about? Those that are working well with teleworking, we're just going to let them continue and not worry about getting to the 50%. I think that I think it sounds like we're reinventing the work environment. And go ahead.
We are, exactly. We're not bringing back, we're not trying to get to a 50% or anything. Those that are out there telecommuting now and it works, we want them to continue. And we have given that. The other day I had a director that said, well, now that we're over, I'm bringing those people back. I said, no. If that works, you need to keep them out there. So our goal is to keep on with this telecommuting, and we found in a lot of areas, this really works well. I mean, this is something that doesn't really need to stop. After a while, it's really working quite well.
I've heard that there are lots of areas that there's more productivity.
Yes.
That's what I've heard as a positive feedback. So the financial picture about everything that we're having to buy with the gloves and the masks and everything, I mean, I hope that's not breaking the bank, so to speak. I mean, I'm curious as to what that is looking like financially. I mean,
I do not have the total figure, but I can tell you how we're tracking. Everything is tracked in a sort of a fake COVID account. And Charlie Lanter is all that's going into an account, anything that anybody buys, and all the receipts and everything else, so that we feel that we're going to be able to get this money reimbursed. But that anything we buy, but they want to be careful. And I thought this was very interesting, that you just can't go on Amazon and say, I want to buy blank. Todd and Pat have got to buy this from sources that are going to be recognized and, you know, can do volume. So that's why we're buying it all centrally.
Okay. All right. Well, thank you.
Councilmember Reynolds.
Thank you, Mayor. And thank you, Sally. Can you clarify just on the temperature taking thing? I did understand from what I had read that, you know, people had to be screened when they came in a building for their temperature. So, and you were saying, I guess, then they were allowed to take their temperature at home before they get there, or what? So what was the governor's, I guess?
If you remind me, I'll just read this to you. This is this is the Healthy at Work phase 1 reopening. Okay. Businesses must require employees to undergo daily temperature and health checks. These checks may be either self-administered or administered by the business prior to the workplace entry. Self-administered temperature and health checks may be performed at home.
Okay. And then do they have to report that to their supervisor?
There is no reporting, but what we're going to do is there is no reporting, but it goes on to say sick employees should be directed to their healthcare provider to be tested and then instructed to quarantine. So what we're developing right now, and it's so interesting because different people in this government, I've really found out, have a whole different set of expertise. And who we're using here is up in risk management. So risk management is developing questions like, and they're taking them off of the CDC website for employees, like to know, like, do you have 2 of these symptoms, fever, headache, chills, and they will do that every morning. We're thinking about what we would do is that may be the kind of piece of paper we can just collect when they're coming in. And that way, we would have this.
Okay, thank you.
Thank you. Any other questions for CAO Hamilton? And so for this next bit of update, we have various commissioners on. We have Director of HR, John Maxwell. So we've got a lot of people on. We've got Pat Duggar, who can answer questions as we go through. So first, and thank you very much, Sally. That was very good. We're working these things day by day. And so public safety, at this current moment, police has 1 employee in quarantine. Community corrections has 5 in quarantine and 2 in isolation. One of these employees returned to the hospital after being released due to breathing issues that are likely related to pneumonia. Right now, the fire department has no employees in quarantine or isolation. And the PPE supplies that we've been getting out to different areas are adequate right now to meet the current rate of use in those divisions. And so I would ask, before we go on, let's do any questions for public safety. And I know Commissioner Armstrong's on here. Does anybody have a question? That's kind of a brief update on the employees.
Mayor,
yes.
may I just come in and answer Susan's question? I mean, excuse me, Councilmember Lamb's question.
Yes, of course.
Charlie Lanter just sent me up a thing. It says expenditures to date on COVID tracking grant are $214,009. Most will be reimbursed through various federal programs. We may bear a small match on some reimbursements, so it won't be 100%, but they're thinking that the majority of that, 214 to date, would be reimbursed. Thank you, Mayor.
Thank you. That helps put it in perspective, doesn't it? Yes, Councilmember Lamb.
Thank you, Sally or CAO Hamilton, for that information. My question would be to Commissioner Armstrong as it relates to our corrections. Obviously, we've been watching and listening very carefully with the information that's going on down at the Green River Correctional Facility, which is really scary. And now with the uptick of what's going on out at Federal Medical Center, I thought it would be an opportunity for us to be more specific and talk about all of the, at least the most recent things that we've been doing out at our corrections community corrections facility to make sure that we're being aware of and astute in our own facility that we are managing. I don't know if Commissioner Armstrong wants to speak to that or if the mayor does.
Commissioner, do you have a brief update on anything else? I was just mostly talking about employees and PPE.
Yes. Councilmember Lamb, I appreciate the question. If you remember last week, I gave a pretty in-depth review, very long one, in regards to some things we're doing and through the divisions that we got questions about. With that being said, whenever it comes to our detention center, I think what's been most beneficial to us up to this point is that we got started very early. And I don't want to speculate about the two other locations, but I don't think what I've heard is maybe they weren't enacting some of the safety measures that they should have been acting in a more timely manner like we have. And some of the things that we've been doing up to this point, I do think has had a positive impact on our numbers. With that being said, even with some of the, whenever you think about the individuals that'll be coming back to work that COA Hamilton was talking about, we still plan on doing at the door testing of individuals. We still provide them with a mask. We still do the deep cleaning every day of different locations. We're still restricting visitation. We're still going to be doing the things that have been very beneficial up to us to this point. I asked Director Haney and his deputy director to review what other jails are doing in other prisons. And up to this point, the actions we've taken seem to be ahead of many of the other places, and we haven't really identified something that we need to add at this minute. That doesn't mean we're not stopping to continue to review other people's successes and failures.
I appreciate that. I know that we have been onto it really fast and furious, and I think that has really helped us not only with our employees but our community. And I applaud you, Mayor, and all of your administration for the good work and the forward thinking early on. So thank you, Mayor. Thank you, Commissioner Armstrong.
Thank you, ma'am.
Thank you. Are there other questions for Commissioner Armstrong? I don't see any. Thank you, Commissioner.
Thank you, ma'am.
Let me talk just a minute about environmental quality and public works. So there's also a temperature check policy in place at all the field offices in that entire department. Many people are teleworking, and there are other rotational plans in place for employees. PPE and sanitizer continue to be provided to the employees, and the proper use and maintenance requirements for wear is ongoing. And so just yard waste, just a little quick update there. As you know, the plan is in place for yard waste one-time pickup in May. And the issue on that continues to be preservation of the PPE, and the yard waste collection trucks require the workers to manually handle more materials in the Lennies. So we're keeping that PPE up with the waste workers. And we are working on a plan to restart regular yard waste collection. We have, as you know, suspended the e-waste collection. We're working on a plan to restart that. And then I wanted to tell you that the Haley Pike landfill, the waste collection point, which if you've been out there to see it, you just drive your truckload or your bags, your brown bags of yard waste and dump them on a pile. They are consistently seeing 90 vehicles a day dropping off yard waste, which is really good. And we made that free for our citizens through all of this. I believe maybe Commissioner Nancy, are you on? I'm not seeing Albright, Commissioner Albright. At any rate, if are there any questions? If Commissioner's not on, probably Sally or I can answer them. Yes, Councilmember Swanson.
Thank you, Mayor. I'm wondering, as we resume the yard waste collection, has there been thought of limiting it to just the bins that can be picked up with the arm, the mechanical arm?
We have had conversation about that. Part of the problem is I don't believe all the trucks for yard waste have the mechanical arm. Sally,
That's correct. And Glenn, are you on?
That's
Okay.
the issue.
But that's been the issue with that. The trucks.
It might be worth making that as clear as possible through the media, because that's something we're all hearing a lot about, and it doesn't make sense to people why we can pick up trash but we can't pick up yard waste, and that's a perfectly simple, straightforward explanation.
That's a good suggestion.
Yes,
We'll
the
do that.
messaging.
Yes.
We need to do a better job of the messaging. Thank you. That's exactly right. Okay, what other questions? Councilmember Swanson?
No.
No? Anybody else? Okay, let's move on to social services. So many of our activities right now are focused on provision of food access, care for senior residents, and the well-being of our vulnerable youth. So a couple of things. The phone lines at the senior center remain open to citizen calls and any inquiries or referrals. They've been doing a great job out there. Priority's been placed on feeding and nutrition for seniors. And then the Family Care Center is managing a donation distribution program for supplying needy families with baby formula, diapers, personal hygiene items. And then there are supplemental meals being distributed through the Family Care Center. And then the juvenile probation officers are continuing to manage their caseloads and stay connected with their teenage clients and their families. So even though some facilities like the senior center are closed, they are providing really up-tempo operations to help with the things that are going on. And Commissioner Ford, are you on? I don't know if we have a couple of phone numbers, but I'm not sure who's on. Sally, do you have anything to add to that?
I don't have anything. I think that senior center will be one of the last places to open.
Yes.
If that follows, the trend of everything, because all the independent living places are locked down. So I would expect this to be way in the summer.
Yes. What questions do you have, council members? Councilmember Lamb.
You know me, I always have questions. I know that I have been asked by several of my constituents about the senior center. So you talked about the messaging that Councilmember Swanson's good idea about the arms on the solid waste trucks. It might be a good idea to just to have some more information as it relates to the senior center, because I've had a lot of people asking about that. Obviously, it totally makes sense that you would not open up that facility at this time, giving all of the parameters in place. But I think that it'd be good to perhaps maybe say something publicly about it.
Councilmember, are the questions more toward the when will we open, or are they other types of questions?
No, they're wanting to open and be able to come
Okay.
back in to be engaged with, just like everybody else, you know. People are
Yes.
wanting to, I think we're going to have a whole different perspective of what togetherness looks like, and it
Yeah.
feels like once this is over with.
Right.
We're
I
probably
agree.
forever going to be afraid to touch anybody, but you know,
Right.
but I think that's good. The other programs, I mean, our social services, as far as for our youth, I mean, are we still trying to connect with people via phone I mean, how are we handling some of the youth, you know, out at youth services with our employees? I mean, I should probably know better about how that is being managed employee wise. Are they just teleworking?
You're talking about, are the employees teleworking, and are
Right.
they?
For the, you know, like out at the Audrey Grievous Center. I mean, I assume that all of the ones that I know what CASA's doing now, they're located separately from the Family Care Center now, but all of those entities that have actually been keeping them like in a social work atmosphere where they've had they're keeping in touch with the different populations. Are they able to do any of that through phones or anything like that?
There's a lot of that going on, and
Okay.
I don't know if CAO has any detail, but I know that they are all, that is their focus, is
Mhm.
doing their job as well as they can while they're teleworking.
Mhm.
And I don't know if you have any detail,
I
Sally.
don't have any detail, but I know they are all teleworking. So
Mhm.
they are keeping
Yeah.
in contact. And, you know, it's the same thing, I think, out at the senior center. I think that they're trying to keep in contact with as many seniors as they can. They're checking on them is what they're doing. But I agree with you on our messaging.
Okay. All right. Well, thank you. Thanks.
Yes, thank you. Councilmember Masadi.
Oh, okay. I think I'm good. Hi, everyone. Good morning. You know, I think so many of us have questions in different areas. Is there any way, in Sally or CAO Hamilton, I don't know if this is too much of a burden on your department, that you could kind of give us maybe weekly, like a Cliff Notes version on what's happening in each division as far as that because I know a lot of us have newsletters and we disseminate that information through that.
Yes.
And I thought there was some way we could get from you maybe synopsis weekly or every 2 weeks.
I'll be glad to do that. I'll be glad to do that. You know, we were sending these out we were sort of alternating that we were sending these out, and they were pretty repetitive. The thing,
Right.
But what we'll do is I think that's a good idea. We'll do a synopsis of each one and send it out to you once a week. And, you know, and that will just be what a particular division is doing or not. That won't be any trouble at all.
Okay, that'd be very helpful because I think, as I know, most of us send out newsletters, and we could push that out to the constituency and just give them more information. It just provides clarification.
That's good. We'll do it.
Okay.
Good.
Thank you very much.
Okay, you're welcome. Did I see your hand up, Vice Mayor?
Yes, ma'am. Thank you. And good morning, everybody.
Morning.
I had a question about some of the services that the senior center and some of the satellite centers have provided in terms of exercise classes. A fair number of the places, the private sector places, are now doing online classes. Has there been some consideration given? Because I think that's one of the things that a lot of seniors are really missing and could be delivered via Zoom.
I agree with you. I don't know that Christy's on. Are you on, Christy?
No, she is not on, and I don't think Chris is. But that is, again, I'm so glad we're doing this because these are really good ideas. We will get with Chris and see if we can't get something like that started. Because you're right, they're all doing all these gyms, and everybody are doing all these exercises online. I do them all day long.
So are the people who are delivering those
in
classes,
her office?
Excuse me,
Most of
sir.
those people, are most of those people full-time employees? Are they contract? And what, does it entail additional cost or?
I think the majority of these have been part-time employees, but we still, we have kept we have not done seasonal, but we've kept these part-time employees doing other things. So I think we probably can get this arranged.
We
great.
can figure that out with Christie and Commissioner Ford, can't we?
Yes.
Okay, great idea. Thank you.
Okay, thank you.
Councilmember Reynolds.
Thank you. I have a question on another matter, but I didn't know if now would be the time for that, or if
Is it social services?
No, it's not.
Look, if we can run through the other, I don't have a whole lot more, but then we can do general questions. Would that work for you?
Yeah, that'd be great. Thank you.
Okay. Councilmember Plomin, did you have your hand up?
I did, Mayor, but it's got something to do with something else. I'll wait.
Okay. Anybody have a social services question? And okay, thank you. We will move on to the CIO.
James Brown has one.
Oh, I'm sorry. Councilmember Brown, James Brown.
Thank you, Mayor. In regards to social service agencies in last year's or the current year budget ESR partners, are we able, even with the shortfall, able to continue funding them in the last quarter of the ESR grants?
Their budget is intact.
Yes.
For this year. And we're not, just so it's not that I don't want to talk about it, but I want to do, this is for COVID related things, but yes, they're intact for this year.
Yeah, and the only reason I ask, and I think it's relevant to COVID, is because it's impacting our current budget. I wonder if it was going to have an impact on the disbursements that we make to them in the fourth quarter.
I mean, my sense is no, they will be funded through June 30th.
Yes.
As you all voted in the budget.
Okay.
Yeah.
All right.
So, let's see. Councilmember Ellinger, did you have your hand up about a social services question? We're on social services.
No, ma'am, I didn't. I don't know why it is.
Don't worry. Well, it is what it is. Okay. We're all getting used to this. Okay, so any more social services questions? I'm going to go on to the CIO. So Aldona's done a great job of working the tech group, and the entire computing environment is operating, and 85% of the staff are telecommuting. They're working remotely. And they were the first ones, I believe, CAO Hamilton.
That's correct.
Mm-hmm. And they started right away handling payroll and HR and all of that remotely, and it's really worked well for them. DES staff has been implementing and monitoring the Families First Coronavirus Response Act. You know, the Families First Act included the 2 weeks of extra sick leave and the FMLA extension. So they've been monitoring that, implementing that. We increased the telecom bandwidth for several hundred of our employees from throughout government, different departments, so they could remotely work. And the help desk, which many of you've probably used like I have, is functioning remotely, and they continue to respond to any ongoing issues. And then so they're full throttle. And I don't know if Aldona is on this call. Are you on, Aldona? Okay, do you have any questions that maybe Sally or I could answer? Council members?
Mayor?
Yes, ma'am.
I have some more information. And that
Excellent.
was just asked about social services. I'm
Okay.
just learning all kinds of things on this call as everybody's texting me. Let me tell you.
Commissioner Ford is also on the call now.
Okay, well, good. So we are doing, the Lexington Senior Center is doing the exercise classes, and they're doing them on Facebook. And who is doing them is Christy. Christy is starting them for seniors. So she's doing it. Then Monica just texted me and said that Therapeutic Recreation is offering online Zoom classes.
Fantastic. That's great update.
So
And that also that on the seniors too, they are still doing, Councilmember Lamb, they're still doing a newsletter, their newsletter with good information for their participants also.
That's great.
I may know a lot of things by the time I get off of here.
I think we all will, right?
Yes.
Council members, do you get their newsletters? Maybe
I'll make sure that you do. Okay.
Some are saying yes, some are saying no.
We'll make sure that everybody's getting them.
Because that will help you post things on your newsletters too and your updates. Okay, thank you. Anything about CIO? Councilmember Masadi, did you have a question about CIO?
No, ma'am.
Okay. Vice Mayor, I see your hand for CIO.
Actually, I wanted to go back to the question of the senior center and being online. I only have an N of one, and that is someone in my household who has been using those exercise classes. She was unaware that they were online at all. So I think she gets the information, but how has it been? It's been going out in newsletters to all the people who took classes, or how have people been being informed?
I don't know that. I'll bet you I get a text here in just a minute to tell me.
Ford, Commissioner Ford is on. Do you know Commissioner Ford? I'm so sorry. Commissioner Ford, you sound like Donald Duck. The connection might be a little rough. Commissioner Ford, I'm so sorry. You might need to hang up and get back on. Okay. I think if the member of your household is a member of the senior center, she should be getting their newsletters. But
it is okay. Here's my last text.
I can only report that it's been conveyed to me that she was interested in online classes, and so far as she knew, the senior center wasn't doing any.
Well,
taking classes out there and so on and so on.
Okay.
I think he is correct. It is on their Facebook page, the information, and they have just started those classes.
Okay.
Okay.
So that I think
that's helpful.
Okay.
Thank you.
Great.
Thank you.
Great. Commissioner Ford, I didn't want you to not have an opportunity to answer. CAO Hamilton said that the classes are just getting up and running, apparently, and that you go to Facebook to find those. Any other CIO or social services? Councilmember Lamb.
Thank you, Mayor. As far as the CIO goes, I've noticed that we have recognized in the City Hall when those are, I guess Commissioner Ford is a perfect one of many examples of a little quirks in the system. But I noticed that when we are streaming your like press conferences, things from the council chamber, and if I'm watching on my laptop at home, I don't know if this is me or if it is something that everybody is experiencing, but there is there's a blip. The picture is jumping during the press conferences, and I don't know if any of my other colleagues have noticed that. And I don't know if it's a bandwidth or streaming thing from from our Lex TV, or if it is something on my end of it. But that's something that I think could be checked into. And I've been meaning to send an email about it, but obviously I've not had a chance to do it. But
I think Chris Edwards is on, so he's heard your concern. Chris, are you on? Someone from Lex TV is on. And we'll be sure they know about that concern.
Because when you can go back, yeah, you can go back and watch the press conferences, and you can see it in the video where it's kind of it's jumping. And I guess I feel like that we have really probably made great strides in finding out what our capabilities are, and which I'm really appreciative of. But also, I'm sure we've learned of things that we need to improve on, and I'm hoping that anything like that is made a priority going forward, so that we can manage in situation and environment like this, which could be something that we have to use in the future. So thank you so much.
Okay, well, it's good to know that. Thank you for that feedback. Councilmember Plomin, is your CIO or social services?
Social services, and I might have missed this, but are we still going out with our homelessness van? I guess probably not because of social distancing.
The van, Commissioner Ford, I don't believe the van is operating, is it? It hasn't been operating for quite a while.
Oh, okay.
I don't believe so, Mayor.
Okay, I'm not sure, so I thought I'd ask. Okay, thank you, Mayor. Thank you.
Yeah, it's distancing that's the problem. Chris Edwards, did you want to add to the jumping around conversation on the press conference?
I did not hear the question, Susan. Councilmember Lamb, could you repeat the question for me, please?
Yes, thanks, Chris. And I've been meaning to email, and I just keep forgetting to do it. But during the press conferences, when they are live and even on the video, on my end, the video it's jumping. There's like I don't know what better term to use, but and I don't know if anybody else, any of my colleagues, are watching it and seeing the same thing. Because if it's something from my end, I need to look into that. But while I'm streaming here, everything's fine. But it's on the press conferences, and when we're in the chamber, when you're shooting those live.
I have not experienced that or seen that or heard that from anybody else. Press conferences are being streamed and televised the same way we're doing these meetings, same way we do normal council meetings and so forth through our control room here in the government center. So I have not experienced that at all, or heard anybody say they've had that problem. And lately, what we've been doing in news conferences is providing a pool feed for the news media. And a true high definition signal we feed into them out in the lobby of the government center, and they haven't mentioned any problems with the video either. So
must be on my end then. Okay, well, clearly I need to check my bandwidth.
All right, thanks, Chris.
You're welcome. Thank you.
All right, I have 3 more areas to cover that are on the agenda, and then maybe we can have a few questions. Law, just a couple things. Law does an interpretation of every governor's executive order, and as you know, there have been several. And they are also busy drafting policies and procedures. Many of the attorneys have been working remotely, and they've been assisting with the legalities that are being discussed about the restart plan for boards and commissions, so that the boards and commissions, which you all know, we stopped all meetings back in March until we could get this figured out, how for them to meet remotely. So they've been working on that. And we do have the, for example, the Police and Firemen Pension Board requested to meet. And so that board is going to meet remotely. And so some of those are going to start back up remotely, but it's one by one. So any questions about law? That's kind of quick, and I know that on occasion, Commissioner Speckert has had some of her senior managing attorneys who come in one at a time and that sort of thing. Councilmember Masadi, did you have a law question?
I guess so. In reference to the boards and commissions, who's going to be the determining factor whether or not to have these meetings? Is it the chair of that particular board, or you are?
Yeah, they just have to. The kind of rule is that since I stopped them all in the beginning, they just have to ask permission, and CAO Hamilton's helping me with that. We just have to be sure that there are no more than, they're not in public, they're not in a room, they're all visual and virtual like this. And so of course, Chris Edwards is in the middle of all that. So
right. I understand. I know some have an effect on the budget. That's why I was asking about that. That will have an effect on the upcoming budget. Some of the boards do. So I was just curious about that.
Yeah, and we're trying to help them if they feel they need to make decisions soon. We're recognizing that some of them have to meet. The pension board that's going to meet, for example, we vote on expending pension funds and paying out pensions and that sort of thing, and approving retirements, and these are important issues. So if they have a really great, reason to get back in action, we certainly want them to. Any other things about law? Questions? We've got about 10 minutes. Chief Development Officer in Planning, they're working remotely and they rotate staff. They've got rotational staffing plans in place. They're also helping lead an economic recovery committee along with the Chamber of Commerce. So anything there? We have a lot of our Chief Development Officer, Kevin Adkins' staff, Elodie and Jim Duncan and Ashton Potter Wright. They're all helping staff those restart committees. We've got Quinn Welch in there and Craig Benz. They're all helping staff all that. So anything about that? Yes, Councilmember Reynolds.
Thank you, Mayor. Could you briefly kind of describe for everyone the point of the subcommittees and how many there are?
There are about 15. I don't have the information in front of me. There are about 15. Each one represents different sectors in the community. And the whole point is to, Luther Deaton is co-chairing it with me, and then Mary Quinn Raymer is vice chair for tourism and travel, and Bob Quick is vice chair for the economic side of it. So they're each tasked with crafting a plan to reopen for their sector. And so they have, for example, the restaurant bar sector has craft beer people on it. It has owners, it has distillery owners, it has restaurant owners, it has caterer, those sorts of folks. And their job is to look at the governor and the president's guidelines for reopening and see how they can do that. How does a bar reopen by, this is an example, by following 6-foot distancing, masks, hand sanitizer, all those guidelines that are still going to be in place. So that's kind of basically what they're tasked to do. And then we're going to put it all into a blueprint for Lexington and send it to the governor.
Thank you. I just think that that's helpful for the public to know as well. So thank you very much.
I agree. Thank you. Councilmember Lamb.
Is the Planning Commission, talking about the planning, is Planning Commission starting back up yet, or are they still on?
Not yet.
Hold. Okay. All right, thank you.
Councilmember Ellinger.
Thank you, Mayor. Just to follow up when you were talking about the plan, that's on a very quick timeline. Can you go through that timeline on when it has to be done, when we're getting it to the governor, please?
Yes, these groups, I wanted them to be nimble and use common sense and turn this around, and they're to have their plans back to me by May 15th. That's the end of next week. And then we will put it all together and send it to the governor on the 18th. Now, we know some sectors will potentially open before that, but that's okay. We want to have our plan in place for Lexington and Fayette County. So it is a quick time frame. I think it's okay. It's doable.
Yeah, thank you, Mayor.
Thank you. What other question about economic development planning? Okay, let me just give you a couple more broad things in the COVID-19, which this is about. So we're working on a plan, a program. You will remember the big UK HEALS grant for opioid work. We're working on a plan for the jail and naloxone. I don't know any detail about it. We have been in the mayor's office leading efforts to get the minority community tested. Early on, you all know that through the general testing, we recognize that the minority community, particularly the African American community, was disproportionately showing up with positives to the virus. And we worked with Laura Hatfield, who we've had several meetings with the Black pastors who are leading this effort to get the word out to their congregations. And so the governors, we took this to the governor, both Mayor Fisher and I, and he helped facilitate the Kroger testing sites in Louisville and here in Lexington. At Lexington, it's BCTC site, as well as the Walgreens site. And I just wanted to give you an update. At the Kroger site last week at BCTC, there were 1,523 people tested, and over 25% of those were African American. And we are consistently testing between 350 and 450 people per day, which is really good. So the governor has worked with Kroger to do a third week at that site. And as the results are coming in, we are seeing about 5% tests that are positive. And that was not really unexpected, because the Kroger site is open to anyone and they don't have to have symptoms. They just have to make an appointment. Both testing sites, Walgreens, and which Councilmember Evans is in your district, and then BCTC, Councilmember James Brown is in his district and borders on Councilmember McKern's. They're both going to be up and running again next week. So encourage constituents, if they haven't been tested, any constituents, to go there and be tested. You have to go on Kroger Health. Let's see, it's krogerhealth.com and register. And then Walgreens doesn't require an appointment, but you're supposed to have symptoms. So the Federal Medical Center, as you know, has been a real struggle. We have talked about that. We've talked about it publicly. And from the second that we learned that they had positives out at the prison, the health department tried to work with them. And we have been working with employees to get testing plans in place, because as you know, many of our citizens work out there. We took it to the governor, we took it to Senator McConnell, and they have been pushing the Bureau of Prisons. So we're slowly beginning to open up to where at least we can get the employees tested. It's been a work in progress. So that's kind of a brief update. We have about 3 minutes for questions on any of those. Since this is a special meeting, your questions need to stick to the COVID response. But what other questions do you have? We still have several commissioners on and folks who can answer questions. So what else? Okay, we've got Councilmember James Brown, then Councilmember Reynolds, then Councilmember Plowman.
Thank you, Mayor. You answered one of my questions. I was wondering if they were going to be able to extend that testing at the BCTC site, and I think that's good news. The health department, I know, had a limited amount of home tests that could be mailed out. Do you know if that's still the case, and are they building capacity for folks that can't make it to the testing sites and can get that?
They are. That is not a that is not an open to the public process. We are trying, as you know, to get those tests done with folks who live in some of those East End neighborhoods.
Okay. Yeah, I just, I think, no, I just think that's a good service that's provided too, because what the other thing that I continue to hear is folks are wanting a walk-up service, which I know puts the healthcare workers at more risk if we do that. But
well, you'll be interested to know, we took an idea to the governor about a mobile van. And he was pretty excited about it. We're working with the health department to see if we can make that work. So a mobile van would go through the neighborhood. It's not exactly walk-up testing, but it's close.
Okay.
Yeah.
All right. But yeah, but that's good that they're expanding that test at least another week.
Yes.
The other test I think is important is the antibody test. Do we have any kind of idea of when that test may be available or come online? Because I think a lot of folks that aren't experiencing symptoms, but would be interested to know if they've already had it or just asymptomatic.
I know a lot of people are interested in that. From what I understand at this point, there are many different antibody tests and there's no real control over them yet. And so the FDA is trying to get in there and make sure certain standards are met. So they're working on it.
Okay. All right. Thank you, Mayor.
Thank you. Councilmember Reynolds, did you have a question?
Yeah, well, I just wonder, is there anyone on here from the health department on this call?
I don't think so this morning.
Okay. I know that some of the demographics coming out of the medical center kind of change what it looks like for Lexington and our demographics. So I might have some more information that I can share about that tomorrow at council meeting. But if there's no one on here, then I won't ask that question right now.
If you need something to go to Dr. Humbaugh, I think, are you connected with him?
Yes, I'm connected.
Okay, good. Okay, good. And then Councilmember Plowman.
Thank you, Mayor. This is back to the swimming pools because I keep getting emails and phone calls from all these neighborhood private swim pools, and some of them pretty much say they're going to open. And I just wanted to share what the repercussions is. That from the health department that's going to go by, and if they're open, do a citation.
Yes, any pool that is regulated by the health department, which is any pool except if it's in your backyard, the governor has not allowed them to open, and they will be cited by the health department.
Okay, great. I just wanted to get that clarified when I talked to you. Thank you, Mayor.
So it is just a hair after 12. I hope this has been helpful. If it has, we can do it again for another day update. If it hasn't, let me know. And because I know it takes your time. I see one thumbs up too. But I thought it might be helpful. And I appreciate all of you who, great thumbs up, Councilmember Swanson. You've got the electronic one. So I just so appreciate each and every one of you. I want to thank all the commissioners and Pat Duggar and John Maxwell, and everybody who's been on, CAO Hamilton, because we've got to figure out ways to share information. And I think that's really critical. So this was just one more, and thanks a bunch. I'm going to go on my next call, and you all have a great day. Thank you.